Okay, so I'm Kimber Bogart. I'm a senior officer at the National Academy of Medicine, and I'm going to present the Transforming the Workforce for Children Birth through Age 8, a Unifying Foundation Pathways to Implementation project that we're doing in the Innovation to Incubation program at the National Academy of Medicine. So I'm going to start with the study, and there's an abbreviated statement of task. The statement of task is quite a bit longer than this, but the abbreviated statement of task is how can the science of children's health, learning, and development inform how the workforce supports children from birth through age 8? You'll find a full list of the committee members and sponsors on the website, but I'll just note that LaRue Allen at New York University chaired this very diverse committee, and there were 4 private foundation sponsors: the Packard Foundation, Gates Foundation, McCormick Foundation, the Kellogg Foundation, and 3 federal agency sponsors: HRSA, Administration for Children and Families, and the Education Department. So I like to read this quote from the report that the committee presented in the report, because I think it really gets at the heart of the importance of this topic. So I'm going to read it. It's that children are already learning at birth, and they develop and learn at a rapid pace in their early years when the environment, supports, and relationships they experience have profound effects. Their development is not only rapid, but also cumulative. Children's health, development, and early learning provide a foundation on which later learning and lifelong progress is constructed. Young children thrive when they have secure, positive relationships with adults who are knowledgeable about how to support their development and learning and responsive to their individual progress. Thus, the adults who provide for their care and education bear a great responsibility. This slide is a graphic of an overview of the recommendations, and it's in the Blueprint for Action chapter at the end of the report. And as you'll see, everything is built on the Unifying Foundation at the bottom, and this is grounded in the science of child development and the principles to support quality professional practice. At the core of this model and at the core of the recommendations are the most direct actions for professional learning systems, and these would be the recommendations in blue. Recommendations 1, 2, 3, 4, 5, 6, and 7. So the first 3 recommendations, 1, 2, and 3, refer to qualification requirements. Recommendations 4 and 5 refer to higher education. Recommendation 6 discusses recommendations for professional learning during ongoing practice. And recommendation number 7 discusses evaluation and continuous quality improvement. But to be successful, the committee indicated that these recommendations need to be framed by supporting actions as well. So you'll see recommendation number 8 is on leadership. And so they really outlined that in order for these core recommendations to be successful, the system needs informed and supportive leadership. Recommendation number 9 is about interprofessional learning and practice. So children's needs depend on different kinds of practitioners working together well within care and education, and also with other sectors, especially the health and social service sectors. Recommendations number 10 and 11 deal with coherent funding, policies, guidance, and standards that need to be adaptive, and they need to respond to changes over time. And then recommendation number 12 outlines how models can successfully implement in ways that are comprehensive and yet tailored to context, to local circumstances in particular. And then recommendation 13 refers to other ongoing knowledge generation, producing the knowledge that will prompt the need for adaptive changes over time. So in no way is the science in this report supposed to be the end-all and be-all. So new science should continuously inform how we support the early childhood workforce for the workforce who work with children birth to age 8. And for these changes to be possible, coordinated actions are needed by multiple stakeholders, often working in different systems and at different levels. So these need to work in synchrony. That means change at the local, state, and national levels, as you see over here on the left side. So I'm going to briefly walk through the recommendations in the report. So there's recommendation number 1 is to strengthen competency-based qualification requirements for all care and education professionals working with children from birth through age 8. This recommendation applies to any organization that has a workforce policy or incentive for hiring, for licensure and credentialing, for grant requirements, and for quality ratings. And so recommendation 1 makes a call to review standards and policies for workforce qualification requirements to make sure, 1, they're competency-based, but secondly, that they're based on the up-to-date science of child development. Remember, our foundational activity that we need to make sure all the recommendations are grounded in. And thirdly, to reflect shared foundational as well as specific and differentiated knowledge and competencies. And so some of the implementation considerations that the committee thought about as they were drafting this recommendation is that there's a number of different areas that are most in need of review and sometimes neglected. And those include this list here. So family engagement, assessment, addressing stress and adversity, teaching subject matter content, fostering social emotional development, promoting general learning competencies, working with dual language learners, and integrating technology into curricula. So you see there are some particular areas, but also some populations that were called out in the report that are not always paid attention to. So the second recommendation is to develop and implement comprehensive pathways and multi-year timelines for transitioning to a minimum bachelor's degree qualification requirement with specialized knowledge and competencies for all lead educators working with children from birth to age 8. We typically get questions about how we define a lead educator, and so the committee outlined this very clearly in the report. They stated that lead educators are those who bear primary responsibility for children in formal care and education settings and are responsible for planning and implementing activities and instruction and overseeing the work of assistant teachers and paraprofessionals. So that means they include lead educators in classroom and center-based settings, center directors and administrators, and owners and operators and lead practitioners in home-based or family child care settings. This graphic identifies how everything needs to really work together related to the second recommendation with the degree requirement. So there are multiple factors that operate like interlocking gears. So in any one of these are not in place, they'll make it very difficult to actually reach the bachelor's degree expectation and qualification requirement. So you see things here like governance and oversight policies. Obviously, financing and funding is important. Also, availability of high-quality degree programs, access to those programs, availability and access to high-quality ongoing professional learning, making sure that recruitment and retention strategies are in place, compensation parity, which is very prevalent in dialogue and discussion in the field today, making sure that workplace policies are in place, positive work environments that are supportive, as well as informed and supportive leadership. So the third recommendation is about strengthening practice-based qualification requirements for all lead educators working with children from birth through age 8. So this recommendation refers to making sure, is really referring to the induction period, and making sure to incorporate an induction period with closely supervised practice before final qualification for autonomous practice. The committee came up with some implementation considerations, and one of them is to ensure that we develop a greater number and diversity of field placements capable of providing this kind of professional learning with appropriately qualified supervisors and mentors. The fourth recommendation is to build an interdisciplinary foundation in higher education for child development. So this foundational baseline, it cuts across professional roles and sectors, And this foundational baseline should really orient students to the field through an interdisciplinary introduction that incorporates content from multiple fields associated with the science of childhood, including team-taught courses across disciplines. So this is really about folks breaking down silos within higher ed to ensure that students have a full range and understanding of child development, how to support children as they enter school and progress through the early elementary years. Recommendation number 5 is really our higher education, is another higher education recommendation for our care and education professionals, and it states to develop and enhance programs in higher education for care and education professionals. And so the committee really felt that there was a need to enhance the content of higher education programs and also to improve their methods and document mastery of practice. And these programs that differ by age range, subject matter, or specialized roles should ensure adequate knowledge of birth through age 8. So typically the courses and coursework and curricula could be quite siloed and focus either on the earlier years or the later years. This recommendation is stating that that knowledge should really span birth through age 8. Some considerations for improving the content, curriculum, and pedagogy include aligning content, curriculum, and pedagogy with the core knowledge and competencies that were identified in the report, again, back to the foundational science of how children grow and develop. And also to enable students to develop competencies in child assessment and in the use of information to both improve their instructional practice and communicate to parents. So the inclusion of family and family engagement and hearing from parents was also an important component in this report. Recommendation number 6 is to support the consistent quality and coherence of professional learning supports during ongoing practice for professionals working with children birth through age 8. So specifically, this is about developing local clearinghouses and quality assurance systems that coordinate with state accreditation or regulatory mechanisms for professional learning providers to create a quality assurance, accreditation, or endorsement infrastructure. It's really to make the resources that exist prevalent and accessible, but also to coordinate with state quality rating and improvement systems or other quality improvement systems that apply to programs and services provided to children to ensure that standards and opportunities for professional learning and support for quality practice are aligned and strategically coordinated. So you'll hear me throughout this presentation talk a lot about breaking silos, aligning curricula, content, standards, aligning policy systems and programs within states and communities. So these were recurring themes throughout the report. So recommendation number 7 states to develop a new paradigm for evaluation and assessment of professional practice for those who work with children from birth through age 8. So the committee stated that there is a need to review and improve current policies and systems for evaluation and assessment of educators to assess not only children's progress in all domains of development, but also to assess a broad range of professional knowledge and competencies of the workforce and of the professional who's supporting those children's domains of development, but also to account for settings level and community level factors and to incorporate assessment in a continuous system of supports to inform and improve professional practice. So the actors that are who are identified in this recommendation include federal and state policymakers, including those in elected office as well as those in education and health agencies that administer early childhood care and education and elementary education. It includes school district leadership, including such roles as school superintendents and school boards. It includes school center and program leadership and roles such as principals and center directors. It also refers to representatives of professionals, including professional associations, unions, and practitioner groups. And finally, making sure that representatives of families are also included, and that could mean also advocacy organizations as well as parent groups. Recommendation number 8 is the leadership recommendation, and the committee stated that it was necessary to ensure that policies and standards for care and education leaders encompass the foundational knowledge and competencies needed to support high-quality practices for child development and early learning. And so what this means is for the care and early care and education leaders to make sure that they're strengthening their instructional leadership as an absolute core competency. And for principals to better integrate early learning principles and best practices throughout the principal development pipeline. So recommendation number 9 is about interprofessional practice, and we typically hear the most pushback on this one. This may be the most complex recommendation to implement in places that continue to operate in silos and don't have good cross-collaboration or coordination across sectors. So recommendation number 9 is about strengthening collaboration and communication among professionals and systems within the care and education sector and with closely related sectors, especially health and social services. And so some considerations to help folks on the ground who are trying to address this recommendation include strategies and mechanisms to facilitate collaboration and communication, like training and infrastructure for appropriate sharing and interpretation of information, or stronger connections among services for children and families, and professional learning communities that span roles and cross sectors. So overall, to improve linkages that support children's mental health and socio-emotional development, which are typically areas that are overlooked. So recommendation number 10 is really referring to our coherent policy in the area of the early childhood workforce. So recommendation number 10 states to support workforce development with coherent funding, oversight, and policies, stating that there needs to be a review of all policies, guidelines, and programmatic portfolios. Revisions should be made, and incentives for professional learning and quality professional practice also needs to be reviewed and revised as necessary. But the primary aim should be optimal support for child development and early learning. That should be the guiding light, the guiding principle. It should guide this review and analysis. To revise categorical policies and funding streams to identify and remove barriers to continuity across practice settings, professional roles, and age ranges for the birth to age 8 span. The committee understands that the early childhood field really grew up as a siloed organization, and it lacked some sort of unifying foundation. So this review should keep that in mind and try to break those silos down and try to provide that continuity across settings and roles and the age ranges. And finally, to utilize collaborative efforts like interagency working groups, technical consultations across government and non-governmental organizations. So recommendation number 11 refers to coherent national guidance for the workforce. So to collaboratively develop and periodically update coherent guidance that is foundational across roles and settings for care and education professionals working with children from birth through age 8. And as you've heard throughout the recommendations, the committee had a consistent focus on the age span from birth through age 8. Rarely did they mention throughout the report anything specific to just the preschool age children or just elementary school age children, except in the science where that was relevant. But really, we're trying to break down silos with this report and try to bridge based on that developmental knowledge which underlies all the recommendations. So under this recommendation number 11, the aim is to promote consistency among the various entities with oversight and influence over the many professional roles that entail working with young children. So providing comprehensive guidelines based in the evidence and drawing on collective expertise in the field, the committee believed would improve the availability of high-quality, continuous developmental support and learning for children as they age. So continuing with recommendation number 11, So recommendation number 11 is quite a large and extensive recommendation in the report, and it also addresses federal agencies and national philanthropic and other private sector funders as the actors, also in recommendation number 11, to catalog current related activities, to develop a plan for a more permanent organizational infrastructure for a collaborative effort to provide national standards and guidance, and to identify the needed participants, develop a common agenda and initial priorities, and to solicit funding commitments for ongoing support. So recommendation number 12, the committee felt that there should be support for comprehensive state and local level efforts to transform the professional workforce for children birth through age 8. So really to create coalitions, and these coalitions should be comprised of relevant leaders and stakeholders at the level of the district, municipality, county, and regions within a state, or the whole state itself. And coalition representatives might include government agencies in health, human services, and education, crossing early childhood, elementary, and higher education. The coalition could include governmental and non-governmental workforce and economic development agencies and organizations. It could also include elected officials and executive offices and state legislatures. It could include local councils or school boards, philanthropic and private sector funders, representatives of practitioners and leaders across practice settings and age groups within the birth through age 8 range. The pilot initiatives, according to the committee, should be selected through a competitive federal funding initiative that leverages existing federal funding streams for workforce development in the education sector. These pilot initiatives should be collaboratively funded as a public-private partnership with national philanthropic and private sector funders. The initiative should also include a matching funding requirement, drawing on state or local governmental and non-governmental resources. So those are some of the implementation considerations for recommendation number 12. And finally, the final recommendation in the report focuses on building a better knowledge base to inform workforce development and professional learning services and systems. Some of the actors included in the report under recommendation number 13 are state and municipal governments in collaboration with non-governmental resource organizations and with the financial and technical support of federal agencies. These should also establish data systems for systematically gathering information on the workforce across those professional roles that we've discussed and settings that serve children from birth to age 8. And they should also include demographics, education, qualification, experience, income, and participation in professional learning. And finally, they should be developed in coordination with other existing data systems that currently gather information on children, which exist in many states right now.
Hello, I'm Ivory Clark, an Associate Program Officer at the National Academy of Medicine, and I co-manage the Transforming the Workforce for Children Birth Through Age 8, a Unifying Foundation Pathways to Implementation program. This activity is under the Innovation to Incubation program, which aims to increase the Academy's impact on health and healthcare by innovating new ideas and incubating actionable solutions, capitalizing on findings and recommendations in our consensus reports. The Pathways to Implementation work was launched after the release of the 2015 IOM report, Transforming the Workforce for Children Birth Through Age 8, a Unifying Foundation. The committee identified 13 recommendations that were both visionary and ambitious. These recommendations were directed to stakeholders at the local, state, and national levels, with the intention to transform the workforce and systems that support children birth through age 8. A clear message from the report is that collaboration will be necessary to succeed in implementation. Soon after the public release of the report, the Institute of Medicine and the National Research Council convened a group of national stakeholders. During this meeting, a broad range of individuals representing many organizations expressed enthusiasm for moving toward implementing the report's recommendations. Discussions at the meeting confirmed the need for launching an implementation phase with a network of state teams and stakeholders who would come together to design a set of implementation plans for states and/or regions that are customized to their context and build upon existing workforce efforts and reports. To date, we have completed 2 rounds with 9 state teams and 1 region. Each team has been generously supported by a foundation. From round 1, the Virginia team received support from the W.K. Kellogg Foundation. The California team received support from the David and Lucille Packard Foundation. The Illinois team received support from the McCormick Foundation. The Washington State team received support from the Bill and Melinda Gates Foundation. And the Washington, D.C., Maryland, and Northern Virginia regional team received support from the Washington Area Women's Foundation Early Care and Education Funders Collaborative. In round 2, the Minnesota team received support from the McKnight Foundation. The Colorado team received support from the Piton Foundation and the Buell Foundation through Early Milestones Colorado. And the Nebraska team received support from the Buffett Early Childhood Institute. Round 3, which has just recently launched, received support from the Indiana State team received support from the Joyce Foundation, and the New York State team received support from the Doris Duke Charitable Foundation. The implementation program utilizes a strategic work plan to achieve its goals, which is outlined as follows. State teams identify a core team of roughly 8 people with 1 or 2 team leads. The core teams then identify an advisory group of 25 to 30 individuals who will help to identify the larger group of stakeholders necessary to engage for implementation. Regular meetings are an integral part of the state team work. Not only are regular calls held, but each round consists of 3 in-person meetings, which are held in one of the member states. During these meetings, teams have an opportunity to work in individual state teams as well as collaborate across state teams. Experts are also invited to speak at meetings and provide TA. We found that at these meetings, teams value the opportunity to share lessons and opportunities, barriers, and most importantly, solutions as they move forward with their work. The core team consists of members that have a bandwidth to attend 3 in-person meetings and work hands-on to develop their implementation plans. These members have connections with multiple organizations working on workforce issues in their states, and they also build relationships with the broader stakeholder groups in their states to receive input and bring to each of the meetings. Advisory members have more time to give, but not as much time as those core team members. Members of the core team do have regular interaction with the advisory group in their states to receive feedback as they develop their plans. Broad stakeholder groups are tapped for input into each draft of the plan, and core teams rework their plans in team meetings based on the feedback from both their advisory group as well as the broader stakeholder group that they've engaged. The role of the academies is facilitative. We are neutral conveners of the state teams and national organizations. We facilitate discussions on opportunities and barriers to implementing recommendations from the report. We bring the technical knowledge of the report and help to catalyze the development of plans that are both actionable and implementable. We work with the other states who also would like to develop plans. The role of the state teams is to build awareness of the implementation plans in their home state by creating stakeholder buy-in and gathering input throughout the process. They are the main drivers of identifying the recommendations which they will implement, the stakeholders they will need to engage, the opportunities and barriers that are present in their states, as well as the timeline to roll out their implementation plans. They are also responsible for following through on the implementation of the plans in the states, and they continue to share knowledge with other states as they roll out their implementation plans. The desired outcomes of this state-level work is to develop a coordinated set of implementation plans that are intentionally and strategically developed, engage broad state stakeholder groups who will collaborate to implement the plans, and using these plans as a vehicle to continue to share knowledge across the states. In addition to the state-level work, the Academy works at the national level with multiple organizations to continue to strengthen the birth through age to age 8 workforce. The focus of this work is Recommendation 11, which is to collaboratively develop and periodically update coherent guidance that is foundational across roles and settings for care and education professionals working with children from birth through age 8. This effort seeks to identify whether a collaborative infrastructure or national backbone organization would best be suited to meet the aims of Recommendation 11. The national group determined that since form follows function, they would outline the function of this body and then determine its form. National stakeholders involved in this work have been convening since early 2016. In April of that year, 35 organizational representatives met with the goal to determine if there was an interest in pursuing Recommendation 11 of the report. There was agreement to move forward and work together. The national stakeholders met again in July of 2016, coinciding with the third meeting of our Round 1 states. And at this meeting, they began to discuss the function of a collaborative infrastructure versus a backbone organization, receiving feedback and input from the state teams. Through continuous discussions, the national group determined that authoring a prospective paper would be an effective means of communicating how they would collaborate. At the December 2016 meeting, they began to draft this paper. It was during the March 2007 meeting that the prospective paper, A Unified Foundation to Support a Highly Qualified Early Childhood Workforce, was finalized, with 22 members signing off. It was published and released in June of 2017 this year. In July of 2017, the national group began discussing the form of a national collaborative infrastructure. The vision for this work at both the state and national level is that the workforces in each state have pathways to achieve higher quality for children, that states are able to garner the necessary political will to roll out their implementation plans, and that lessons from these model states can inform others who also want to improve the quality of their birth to age 8 workforce. As well as at the national level, the national group has come together to further support efforts to strengthen the workforce. Here you can see the various recommendations that each of the state and regional teams took on. California focused on permitting and credentialing, professional pathways, higher education, and workforce registry, which ties to recommendations 1, 2, 3, 5, and 13. Illinois focused on competencies, pathways, and data, which ties to recommendations 1, 2, and 13. The Washington, D.C., Maryland, and Northern Virginia regional team focused on competency-based pathways and compensation, which relates to recommendations 1, 3, 6, and 7. The Virginia State team focused on upskilling the workforce through higher education, with a main focus on recommendation 5 and a sub-focus on recommendations 1, 3, 4, 6, and 10. The Washington State team focused on professional development, data, and compensation, which ties to recommendations 10 and 12. From round 2, the Minnesota State team focused on pathways to the bachelor's degree, with a main focus on recommendation 2 and a sub-focus on recommendations 3, 5, and 13. The Nebraska team focused on interprofessional practice and systems-level change, with a focus on recommendations 1 and 9, and the Colorado team mapped their recommendations onto the Colorado State goals. And this meant that they focused primarily on recommendations 1, 2, 3, and 5, but they're also focused heavily on recommendations 4 and 6 through 13. So there's a wide range of recommendations that each of our state teams chooses to focus on. What we have learned from this work is that there is an ability to leverage and coordinate workforce activities across states. There are diverse political contexts, but there are similar needs, and one of those needs is that all children deserve highly qualified educators. We've also learned that integrating foundational knowledge across health, social services, and protection is difficult, but it can be done. What we hope and envision from this work is that we develop a network of committed states to improving the quality of their birth to age 8 workforce. And eventually we will reach a tipping point in the U.S. where children will have a high-quality educator no matter what setting, funding stream, or program. And finally, we envision that all children, no matter their zip code, family context, or physical condition, can have equal opportunity to reach their developmental potential. Thank you, and should you have any questions, we would be more than happy to answer them.